All right, so we'll talk about two very important things, you know, as associated with the shoulder. So we'll talk about the apprehension test, we'll talk about the relocation test, we'll talk about the sulcus sign. So sulcus sign is away from the physical stuff. Then you're actually trying to, it's still physical, you know, but this one is like something you see. You understand? It's something you see. It's not something like you elicit. You just look at the shoulder. If you see it, it's there. You understand? So let's quickly look at them. So apprehension test, relocation test, and the sulcus sign. So what we have is this. So all of them, you should know that what they are all orthopedic special tests, and they are used to evaluate what shoulder instability. Okay, so purpose is what to dictate anterior shoulder instability. That's risks of all those dislocation and the rest of it. So how is it done? Patient lies supine or sits. Examiner abducts the shoulder to 90 degrees and externally rotates it. If it is positive, patient shows what apprehension as fear, resistance or facial expression, to show you that okay, it's actually painful. You understand? So pain alone is not diagnostic, but this apprehension is key because it will show the fear, the resistance. Do you understand? So it will show a lot of things. Then let's move to the next one, which is what? Relocation. So for the relocation test, this is it. It's just to confirm anterior instability after a positive apprehension. Okay. So for the relocation test is to confirm anterior instability after a positive apprehension. So it's performed immediately after the apprehension. In fact, they are even done together. See, they are even done together. You feel as if it's the same thing, but it's actually different. So the examiner applies a posterior force on the humeral head while maintaining external rotation. So the relief of apprehension of pain when the posterior force is applied shows that what there have been an instability, so the posterior force is what actually stabilized it. Okay. Therefore, the sulcus sign dictates what? Dictates inferior or multidirectional shoulder instability. Okay. So how is it done? The patient sits or stands with the arm flexed at the side. Okay. So the examiner will now pull down the arm. So if you visibly see something like it's going inside, that's a sulcus. Okay, that's like a depression. It simply shows that what the person is not, the shoulder there, everything is not cool. So it's graded by the size of the sulcus. It's often seen in patients with generalized what ligamentous laxity. Okay, so that's what we got for this.